is the Investor Connect podcast program. This is Hall T. Martin. I'm the host of the show, in which we interview angel investors, venture capital, private equity, family offices, and many other investor groups for startups and growth companies. I hope you enjoyed this episode. Thank you for joining us. Well, hello, this is Hall Martin with Investor Connect. Today we're here with Lyle Berkowitz, a physician, entrepreneur, and expert in digital health innovation. He is the founder and CEO of KeyCare, a company that helps health systems offer virtual care integrated with the Epic electronic health record platform. KeyCare aims to expand access to telemedicine, reduce physician burnout, and connect virtual care with in-person care. With coverage across all 50 U.S. states, the company stands out for transforming the way patients access digital health care. Lyle, thank you for joining us.
Good to talk.
Great. Let's talk about your journey from practicing physician to healthcare entrepreneur, innovation leader. What was that journey like?
So it was pretty continuous, meaning it didn't just start with 10 years of practicing and then jump into entrepreneurial world. I was an engineer undergrad. I was always very entrepreneurial. I was computer programming teams, college, med school, etc. And I discovered this field of informatics, which was an intersection of computers, technology, and then the internet as I was becoming a doctor. And pretty early on, almost from the beginning, I was adding on business type of work in addition to seeing patients. I was a medical director of technology in 1995 when we were trying to figure out what that meant. And then I also started taking consulting jobs with industry. Being a doctor who understood computers and the internet was a bit of a rarity back in the mid-90s.
Well, great. Well, tell us about the vision behind founding KeyCare and what was the market need you were trying to address with it?
So over the years, I used computers to improve efficiency for doctors, but also improve access for patients. And one of the hallmarks of what I focused on is, how do we apply some aspects of care? And, I took advantage of the fact that Epic is a leading provider of electronic medical records. Epic is now running, some would say, upwards of 70% of all healthcare transactions. And so we started KeyCare as a virtual care medical group, providing access to the nation. But instead of building our own tech from scratch, we built everything we do as clients of Epic, making it much more coordinated with the rest of the ecosystem out there. So we sort of jumped ahead. So we didn't have to do hard integration. We have very easy integration with the majority of health systems who are using Epic already, and therefore we can support them and the rest of the ecosystem much more easily.
So let's talk about how is virtual care evolving beyond the pandemic into a permanent healthcare infrastructure? What do you see going on there?
So pre-pandemic, virtual care was a nice to have. Payers in particular were paying for it because it would decrease ER visits, particularly in populations who didn't have easy access to doctors. Maybe it was 1% of healthcare or less, mainly urgent care. Post-pandemic, there was a cultural shift. Like people realized, wait a minute, we can do this. Patients and doctors realized they could do it. And more importantly, they could get paid for it. The government, sort of mandated parity so that payers had to pay for virtual care, where before they weren't paying normally for virtual care. They'd have to cut special deals with providers to do it. So all of a sudden, it became something that was easier to use, more convenient, still could do the job for a lot of issues. And now doctors could get paid for it. And companies like ours could exist by being able to bill insurance, often in coordination with the health systems that we work with.
Great. Well, we see AI everywhere, and certainly we see it in the digital health space. What do you think is the role of AI in improving clinical workflows and patient outcomes?
Well, first of all, when I think of virtual care, that to me is a combination of telehealth and AI together. Telehealth is simply doing what we're doing, a Zoom type call with a doctor. Virtual care is a bigger umbrella that implies that we can use AI to make the pre-visit, the visit, and the post-visit easier, more efficient, more effective, etc. So in our case, for example, we use an AI bot to collect information before the visit and tee that up to the doctor and patient ahead of time. We use ambient AI technology during the visit to capture the words and convert them into a note. And post-visit, we can use AI to do follow-up, etc. So it is now just part and parcel of how we can manage. And the truth is, online care, telehealth, we'll call the routine, repeatable care, where AI can really be used to increase efficiency.
Great. So, what are the challenges in health systems face when they try to implement digital healthcare solutions at scale? What challenges have you seen there?
So I often talk about the 3 C's of adoption to get usage of these digital health technologies. Number one is that the care has to be coordinated. A problem sometimes is when they work with a third party that everything's done in a separate vacuum and the care isn't coordinated. And neither the doctors or patients appreciate that. And so we help solve that by being on Epic, or health systems solve that by doing everything themselves, but they have a limit to what they can do. But care coordination is important. Number 2, C, is what we'll call cultural changes that have to come along, that it's a different workflow, it's a different mindset, a different muscle memory, and it has to in some way be easier and better. And you have to have a champion who is pushing forward, showing that it can work. And the 3rd C is compensation redesign. Perhaps the hardest one is that if a doctor is paid less to do something online or feels like they're losing patients to a virtual care partner or to AI, and they're being paid for office-based volume, that's a conflict. And so health systems in particular need to rethink how they pay doctors, perhaps on the panel size they manage and the patients they oversee, not on the patients they actually physically have to see in the office. And that's a big mindset change, but maybe the biggest barrier to acceptance of these digital health technologies that automate and delegate certain amounts of care.
So, what are some of the lessons you've learned building partnerships between technology companies and healthcare providers?
So the number one lesson that I've learned is you have to understand how to align the value proposition and incentives. I didn't go and get an MBA, but I can tell you my MBA in a box is as follows. Incentives matter whether you think they do or not. And if you go into a health system and ask a doctor to change their care or to accept some type of additional technology, and you haven't figured out how that makes their life easier or makes them more money in some way, then you're not going to succeed very well. And so I always ask, who uses the tool? So the doctor, the patient, the nurse, who benefits from it, by either saving time, making more money, and who pays for it? And how are those 3 things aligned? When I was director of innovation at Northwestern, those were the 3 questions I always ask any new startup coming to us, and they better have a good answer to that, or else it's just not going to work.
Let's talk about the future of integrated virtual care and remote monitoring and hybrid care delivery. How do you see, what's the model of that going to look like in the future?
So I'm super excited about this. The truth is, we've been talking about this, the industry, since the 1960s. The concept isn't new. A lot of people act like they're the first ones who thought about it. The truth is, we've been envisioning this for a long time. We're now getting closer to execution. And as I said before, I think one of the key things is making sure incentives are aligned, because what this allows us to do is solve one of the critical problems that we think we have. We think we have a shortage of physicians. I actually suggest we have a shortage of using our physicians efficiently. We have plenty of doctors. If we use them, like in any other industry, we use the top of the pyramid. We create teams beneath them. We give them technology to enhance them. And if we do this right, the panel size, particularly of a primary care doctor, can expand greatly. And I call it my SAD philosophy, to make doctors happy and patients healthy. How do we simplify, automate, and delegate routine, repeatable care? And that is a combination of virtual care and delegation and AI and automation to better manage a population. So again, the doctor sees less patients in the office, but oversees a greater team and a greater panel of patients. And everybody wins if we can do that. But we have to set up people, process, technology, and incentives together to do that. But it's certainly becoming feasible.
Excellent. So, what's your advice for digital health founders raising capital in today's investment environment? What do you tell them to do before they go out to make that first pitch?
Well, every time I talk to an entrepreneur, I give them the story of, focusing on a niche. Years ago, a famous marketing expert was asked, how would you start a company? He said, I'd focus on a very small niche, a family in San Francisco who wants to travel to a small town in Italy and build a travel site around that. Because once you dominate a specific niche, show that you understand product market fit and get some adoption, you can expand beyond that. When these small companies try and boil the ocean from the start, it rarely is going to work out. I mean, if you look at the biggest companies that we have, they all started as a niche, Google and Apple and Microsoft. In some ways, all started as a niche that then expanded and grew. And for a new company these days, you can start a company with 2 people, 1 person even, and good use of Claude, but have a really specific niche that you solve, show that can get some traction, and then build on that. And don't raise money too quickly. Make sure you show you can do something, because investors are looking for someone who shows that they know how to use money and has some traction that they can invest in.
Great. Well, AI is everywhere today. What are the trends you believe investors should be watching across healthcare, AI, and digital health over the next 5 years? Which trends really matter?
So, as I said, in healthcare, we often think about pre-visit, visit, post-visit, and where does AI help, and how does it align with financial incentives? One of the biggest topics that's sort of come and gone already, if you're an investor, is ambient AI, where you're listening to a doctor and patient and creating a note. But we're going to see those companies continue to evolve. And I think one of the biggest trends is watching. Epic is a dominant EMR company. What are they developing on the AI side? Because a small companies trying to go up against that are sort of like a company creating a new spell checker for Microsoft Word. It's not necessarily needed. What I look for are companies that do much more than technology, right? They've got the content and services in addition to technology that let them stand out. So either they're doing something that the Epic and other EMR companies of the world aren't going to do, won't do, or they somehow are doing it better, faster, or cheaper than them. And I think, again, things that make life easier for doctors and better for patients at the same time, while aligning with incentives, you got to have all of those magic things together.
So how do you know if those companies are going to or want to do that technology in the future and take you out versus they may do it? What tells you that you're safe with that, or do you just not know?
Well, you don't know for sure, but you can assume that the big electronic medical record vendors are going to be looking and seeing if their clients want something and it's pure tech-based, they're probably going to build it. They're tech companies. Again, it's just like Microsoft and Apple. If it's a pure tech, they're very likely going to build it. If there's a lot of content or services involved, they might build an infrastructure for it. I had a company years ago where we integrated with EMRs, sort of an app on top of it, and some of the EMRs built a structure that was similar. And so we pivoted and became the content provider for those situations and did quite well with that. You have to learn how to pivot, how to understand who's doing what part of the tech, where you can add value, what you can do above and beyond. A lot of the EMR companies won't touch things that need FDA approval. We're seeing a big convergence, interestingly, of medical devices and digital health, AI, and tech, so that a lot of new medical devices are coming out with AI and tech built in. That's something that the EMR vendors are not touching if you really want to avoid that.
Great. So in today's market, what's your perspective on the biggest opportunities to improve healthcare quality and access and affordability through innovation? What's the biggest or the lowest hanging fruit, I should say?
Well, I think anything that can make a doctor, again, more efficient, help them increase their panel size in a way that feels safe, high quality, and well adopted along with incentives is going to be really important. I think we're also going to see continued self-service by patients. They're going to be able to get more and more of their data themselves and be able to do something with it. I'm a big proponent of one, increasing access to care, making it very easy, which virtual care does a lot. Two, the care navigation space and advocacy space, I think is going to be increasingly important. And there may be both tech and services that support that. Those are two big areas of interest for me. Personally, I'm also interested in longevity. I think that's a very, very hot space. Loneliness and friendship. I'm building a company on that myself right now. And third, the area we call death. I think there's something that's sort of ignored because it doesn't feel like health, but I think everyone dies, and there are opportunities to make that process better.
Great. Sounds like a great set of opportunities there for sure. Well, in the last few minutes that we have here today, what else should we cover that we haven't?
Well, I think the issue, if you're investing in healthcare, is to understand the complexities that come with healthcare. And unlike every other industry where essentially you've got a buyer and a seller, and it feels much more straightforward, healthcare has three big entities. You got your payers, your providers, and your patients. And going from 2 to 3 entities involved increases complexity a lot, especially when and I've taught medical students this in a course on business and organization medicine. The issue we have in America is not that we have a bad reimbursement system, it's that we have so many different ones. And so it's very hard for a company to figure out what are the right aligned incentives when the truth is, in a given patient population the doctor sees, there are going to be different incentives. There's the traditional fee for service, I get paid for seeing you. And then there's value-based care, I get paid for keeping you healthy. And those are very different things. And in a given day, you might see patients that have two different types of models. And so as a startup person trying to figure out how to work in that system, I tell you, when I started one of my other companies, HealthFinch, we focused on non-reimbursable activities because we figured if we can take those off a doctor's plate, they don't lose, whether it's fee for service, value-based care, any incentive system, you don't get paid to do refills, for example. And so the first thing we focused on is how do we automate refills? And that made sure we didn't conflict with any incentives, but it's very tricky. Like I said, go back to those 3 questions. As a health system executive, I ask those. As an investor, I ask those questions when I look to invest in companies, because you've got to figure that out. The good news, so to speak, for healthcare is it's very complex. So there are lots of opportunities for companies, particularly in those areas I mentioned. And anything that improves access right now is certainly one of the hottest areas out there.
Well, this has been great. So how best for listeners to get back in touch with you?
So my website's www.drlyle.com, drlyle.com. And I'm pretty active on LinkedIn. I'll post about stories, etc. Fairly easy to find there. And those are the best ways to reach me.
That's great. We'll put all your contact details in the show notes. I want to thank you for joining us today and hope you have you back for a follow-up soon.
You bet. Thanks, Al.
Investor Connect helps investors interested in startup funding. In this podcast series, experienced investors share their experience and advice. You can learn more at investorconnect.org. Paul T. Martin is the director of Investor Connect, which is a 501c3 nonprofit dedicated to the education of investors for early-stage funding. All opinions expressed by Hall and podcast guests are solely their own opinions and do not reflect the opinion of Investor Connect. This podcast is for informational purposes only and should not be relied upon as a basis for investment decisions.